Welcome, everyone. This lecture will help you understand three key terms that often get mixed up in healthcare: certification, registration, and licensure. You'll learn what each one means, how they differ, and how they apply to medical assistants. We'll also discuss how certification or registry through the AAMA, NHA, or AMT demonstrates readiness for an entry-level career and which professions require licensure. By the end of this lecture, you'll be able to define certification, registration, and licensure, explain how they differ, and describe how each contributes to patient safety and professional credibility. You'll also know which organizations certify medical assistants and which jobs require licensure. Certification is a voluntary process that shows a healthcare worker has met professional standards. It's awarded after passing a standardized exam that evaluates knowledge and skills. For medical assistants, certification shows that you've met the minimum qualifications to work safely and effectively as an entry-level medical assistant. It's not required by law, but many employers prefer or require it. Registration means an individual's credentials are recorded in an official database by a professional organization. For medical assistants, registration verifies that your training and education meet established standards. It doesn't always require an exam, but still represents professionalism and accountability. The AMT offers a registry exam for the Registered Medical Assistant or RMA credential. Licensure is a mandatory government-regulated process that gives legal permission to practice a profession. It ensures that only qualified individuals perform certain healthcare roles. Unlike certification or registration, licensure is required by law. Practicing without a license in regulated fields is illegal and can lead to penalties. Some healthcare professionals must be licensed by their state to work. Examples include registered nurses, pharmacists, respiratory therapists, and radiologic technologists. These professions require education, exams, and continuing education to maintain their licenses, ensuring that public safety is protected. Medical assistants have three main organizations offering certifications or registration: the AAMA, NHA, and AMT. Each ensures that medical assistants meet national standards for competency and ethics. Certification validates your readiness for employment and shows that you meet the minimum qualifications for entry-level practice. The American Association of Medical Assistants, or AAMA, awards the Certified Medical Assistant, or CMA AAMA credential. This certification emphasizes administrative and clinical competence. The AAMA promotes ongoing professional growth, ethics, and patient-centered care through continuing education opportunities. The National Health Career Association, or NHA, offers the Certified Clinical Medical Assistant, or CCMA exam, which is a certification exam used at Tri-C at the end of the medical assisting program. Passing this exam demonstrates that you have the minimum qualifications to work as an entry-level medical assistant capable of performing both administrative and clinical duties with professionalism and accuracy. The American Medical Technologists, or AMT, awards the Registered Medical Assistant, or RMA credential, and maintains a registry of qualified professionals. It promotes ethical standards, education, and lifelong learning. Through certification and registry, AMT ensures that medical assistants are competent and prepared for evolving healthcare environments. Certification, registration, and licensure all ensure patient safety and professional accountability, but differ in purpose. Certification tests knowledge and skills, registration records verified qualifications, and licensure grants legal permission to practice. Together, they create a framework of trust and competence in healthcare. In summary, certification, registration, and licensure each play essential roles in healthcare. Certification shows you've met entry level standards. Registration confirms your verified credentials, and licensure provides legal authorization to practice. Remember, at Tri-C, students take the NHA CCMA exam at the end of their MA program, which validates your readiness to enter the profession with confidence.